Welcome back to Healthcarejobs.ie. Today's video is going to be about how nurses are portrayed on TV and how this is kind of an expectation versus reality of what's showed on TV and what actually happens in real life. I hope you find this video really interesting, so stay tuned to the very end to hear all my 5 points. The first expectation that is portrayed in TV is that everything is black and white, and that is the furthest thing from the truth. Nursing is typically not very black and white because things change and each patient is different. So for instance, visiting hours is a big one that people think is really set. But for instance, if you don't think that your patient is going to make the night, of course you are going to do everything you can to make sure that family member can stay over. So therefore sometimes visiting hours are just not appropriate and are not done. Also, for instance, if you're out of medications and then you order it from pharmacy and they arrive on the ward, the expectation is to give it straight away. And we see this in TV, that it's very kind of visiting times are over, medication has to be given at this time, and that is true. Medication is quite black and white, although there is circumstances where you wouldn't give medication straight away when it comes up from pharmacy. For instance, if your patient hasn't slept in 20 hours, you're not going to wake them up and give them a sleeping tablet. So it's kind of like, you have to play it by ear, and each patient is different. To conclude step number 1, I would say that nursing overall is quite black and white. However, I think it's portrayed more black and white in TV shows and things like that, and I think the reality of it is that the more flexible you are for your patients, the better off they will be, and it'll be more patient-centered care and everybody will be happy. Expectation number 2 is that doctors know everything. This is the expectation, and I'm afraid the reality is not that. Nobody knows everything, but especially not doctors. Think about how little sleep they're getting and how many patients they have. They are put under such a large amount of strain and pressure. Us as nurses, we have a smaller amount of patients and we know them on more of a personal level. Doctors are going around writing prescriptions and seeing so many people that it's really easy for them to make mistakes. But you, as a nurse or a future nurse, needs to be the one to be able to flag things up. For instance, if a doctor prescribes the wrong antibiotic and your patient is allergic to penicillin, you need to be the one who's like, hang on, that's wrong, you need to change this. Because if you're not the one to flag it up, the patient's going to get the wrong antibiotic and they're going to have a reaction. It's also important to remember that you're the one administering, you're the one giving it to the patient, and it's your pin on the line. So don't take any chances with junior doctors or anything. Obviously, understand they have a higher level of skill set, such as prescribing and stuff, than us, but we need to be wary that they make mistakes just like we do. The third expectation is that experienced nurses aren't friendly, and this is not true. Sometimes you see in TV and things that the experienced nurses are the really frowned, scary ones, and sometimes as a newly qualified or as a student nurse they can seem really scary and stuff, but at the end of the day they're just really good at their job. So you need to respect that, and you need to ask for advice when it's appropriate and understand that they are happy to help. They might just seem a little bit more stern, but it's just because they're trying to get things done. And especially if you're a nurse in charge, you've so much on your plate that you're trying to juggle so many different hands, you're in different pots and everything. So try and understand where they're coming from, and if they look really, really busy, maybe be like, oh, better off if I come back in a minute. And they'll really appreciate that, and you'll also get the help you need. So that would be my tip, but it's also kind of an expectation that I would say is not true the majority of the time. Expectation number 4 is that nursing is just a job. You see the nurses in the TV programs and they go to work and they come home and it's very separate. The reality of this is slightly different. Sometimes you will have a horrible 12-hour shift. You will come home and replay everything in your mind, going over every single decision you made, especially if a patient dies or is really poorly and you had to do a lot to help them. you're going to replay that over and over in your mind, hoping that you did enough. It's not a split, like this is my job hat, this is my home hat. As I was saying, it all merges into one. So I think that the expectation that nurses is just a job and you just go to work and you come home and it's very separate is definitely a false expectation. I also think that once you are a qualified nurse, family and friends will call on you for anything. Like, I got bitten by this, what does this mean, what antivenom, I don't know, like we don't know everything, but people expect you to know a lot more. So I would say that side of it definitely is true, and that is the reality of being a nurse. The fifth expectation is nursing school is easy, and sometimes this is portrayed in TV programs where it's just everyone's going to school and everyone's quite positive and they find it a little bit hard but not that hard. And the reality is that everybody at least one stage finds nursing extremely hard, the whole schooling university program. And I can tell you from the bottom of my heart, probably every single person on that course has thought about dropping out at least once. Maybe not seriously, maybe not for hours and hours and hours, but I can tell you the thought has flown through their head at least once. So don't feel like you're alone if you feel like that, but that is a reality of nursing school. It is difficult, but it will be worth it in the end. Also, the reality is that 1/4 of nursing students will drop out before they graduate, and this is the reality. The expectation is that it's easy and everyone can get through it and you don't have to be that smart and blah blah, but the reality is it's a lot harder than people think. And especially the placement part, when your friends are out partying or out doing this, that, have long summer holidays and everything, and you don't have any of that. That definitely is a harsh reality of the nursing course in most places. So these are my 5 reality versus expectations versus reality about nursing that are portrayed on TV. I hope you really enjoyed this video. If you did, give it a big thumbs up, and don't forget to subscribe to Healthcarejobs.ie for more videos just like this one. Bye! Thanks for watching!